Good afternoon, everyone. My name is Rudy Page, and welcome once again to our Systems Performance Dialogues. And this, we talk about shaping our systems in these dialogues because the workforce is the community and the community is the workforce. And today's topic, ethical behavior and accountability in leadership, a technological framework and design for the tracking of blood disorders. And I'm so pleased today we have once again with us Dr. Laura Thompson. Laura, how are you these days today?
I'm doing pretty well. Thank you for asking. How are you doing?
Very good. Good to see you once again.
Good to see you again. Yes, it's been a minute, but it's good.
Exactly. So, Laura, what brought your interest in this particular area?
Well, let's talk. So behind me is a picture of a friend of mine. Her name is Kishma. I've known Kishma for pretty much most of my most of my life. She passed away in 2008. She had the trait of sickle cell on both sides for mom and dad. And at the time, the doctors really didn't give her a long prognosis for living. I think they told her about 18, but she lived until she was 36. And and I'm wearing her jacket. Her mom gave me something. So this is Kishma's jacket. And so this story is a little bit personal to me. So, but I'm really pleased to be here to talk and to share.
Okay.
And to celebrate.
Absolutely. And of course, it's World Sickle Cell Day on Sunday as well. So great. So tell us, what was the origin of the research for the study in this particular article that you've written?
Well, the origin of ethical behavior and accountability is really a leadership discussion. And the origin came from a book that I wrote. It's called Root Systems. And the book was about challenges with ethical behavior and accountability in nonprofit leadership.
Okay, that's pretty clear. And what was the intention of the research and the most significant challenges in leadership?
Well, the intention of the research was to review passive surveillance systems for tracking blood disorders, and sickle cell is one of those blood disorders. So examples of blood disorders: measles, autoimmune disease, SCA. And the target population in my study was mainly children, but it included anyone who had been tracked using what they called surveillance systems, or passive surveillance. And in addition, the study reviewed and assessed other methods towards the development of a framework that could be used for inmate information systems to track disorders. So I've used the idea of the framework with Oz's principle of accountability, which assesses accountability in 3 areas, which is organizational accountability, personal accountability, and also financial accountability. Okay. So that might be a mouthful, but that's really what I wanted to do in this study.
Yeah, we can certainly see the link between all those elements as well.
Absolutely.
So I noticed in the study you reference UNESCO, the Millennium Objectives for Medicine in Nigeria. How do these connect to the ethical premise within the study?
Well, I became interested in UNESCO or in the Millennial Objectives a few years ago. And at that time, the UN had 8 objectives, or 8 objectives tracks. Education and health was one of those tracks. And when I looked at the medicine track, I saw that Nigeria was in the top 5 of countries needing to update its medical standards tracking systems for tracking illnesses. And since my background is in information systems, and I've been to Nigeria, have friends from Nigeria, I've said, this is pretty interesting, let's look into it. So at that time, I had a student who is now, her name now is Dr. Kimberly Scott. And she was interested in sickle cell anemia because she had a trait of it as well. So, and she was studying at the time health health information systems and that sort of thing. And so I decided to partner with my student at that time, and we ran this study. And so at the time we created a model, and this model was a combination of two things. It was a combination of the diagnosed clinical medical codes that we used in the state to, for billing and that sort of thing. And we also fused that with a prototype of a tracking system that contained inputs and outputs. And so what we pitched in the article was this prototype, and we published it, and then we quickly realized that this tracking mechanism didn't exist anywhere, and that gained a lot of popularity. People wanted the transcripts, et cetera, et cetera.
Okay.
Yeah.
So what else did you discover at the time you did that initial study?
Well, I found out that the UN, they tracked these, they track surveillance through their in-depth database. There's an in-depth database. The Nigerian demographic surveillance system had 2 nodes within that database, 2 node centers or 2 access points. One of the nodes was the Nahuche health demographic systems, and the other one was Cross Rivers, and these are 2 communities in Nigeria. Those 2 nodes are still active today, but there are, of course, different leadership. They're taking over the nodes as well. And at that moment, the in-depth database was only tracking like mortality rates. And I figured, well, why don't we, and it's in just 16 fields. So 16 fields, 16 columns, and mortality rates, and that's pretty much it. And so the thing that I said, well, it's easy. I know database technology, just add a few fields. Let's see if any of the mortalities that were happening were related to sickle cell anemia. And then we might be able to create systems to provide resources in those particular areas, right?
Yeah.
It seems like a simple fix. Didn't necessarily happen as the way that I wanted to. We had all the cooperation that we could have, but it was still a little bit challenging. The next thing that I also discovered was that there was another study that was done in 2020, which kind of helps to foster and explain what's going on in this particular study. And this study was specifically on sickle cell anemia and Nigeria. 291 mothers were found that were pregnant and possibly, and they had the trait. And so in the study, the researchers wanted to discover, well, what if we tested you? Do a pre-test, do a post-test with counseling. And what they discussed, and they had everything set up, the clinicals and everything set up, the support and everything set up. But the challenge was the financial. So for the pre-test screening was $1.50 US. And the Naira towards that, it's about, let me see, I'm going to tell you the Naira in a moment. But the actual post-test was only $20 US, but that's like 7,000 Naira at the time. The mothers the mothers that were in question, they didn't have that resource. They didn't have that money. So how do you get people to be tested? And it's the system, the healthcare systems are different. Where some people, when you go to the hospital in certain countries, everything's paid for. In other places, you have insurance. In the case of Nigeria with these women, you have to pay for the test.
Yeah, and of course, if you test, you may find evidence.
And if you find evidence, then there's more things that you have to do. So these are just really good, striking information that I thought was really interesting to what we were doing. And so the way, of course, the way that we track things may or may not be conducive to what needs to happen, but we can model and then posit what we think should happen and see what type of support that we can provide. So those are some of the things that I discovered.
Right.
And I do have some ideas about the future.
Excellent. Yeah, so this sounds quite exciting, and particularly the way the element of discovery as part of this, what you're talking about, and discovery as it leads to more evidence, which can lead to better health outcomes, which is really important.
Yes.
So are there any updates since the project's inception, and what would you like to see happen with sickle cell research and demographic surveillance in the future?
Well, let's just talk about public health in general. Typically, what should happen is that when dealing with sickle cell, there are certain things that need to be in place. For example, there should be new therapy developments. There should be public planning, patient and family planning, and provider education. And I believe that in the 2020 study, those things were in place and part of the $20 or 7,000 naira deal, right? So that's in place, but then the challenge is, how do you get engagement from the people? How do you get people to want to do something of this nature? And then also dealing with potential stigma associated with a person that may find out or discover that they may have something of this nature. So I have some thoughts. Perhaps we had the cart before the horse as it relates to trying to implement a field, which is so easy to insert a field in a database. I mean, I had access to the persons over the databases, and it's just about adding a field. But once the field is added, then there is the other responsibility of engagement to make sure that all the other services
and the implications that surround that. And in a sense, it kind of brings us to the thinking around, the system thinking, the performance. We're now talking probably about the attitude of clinicians, the culture of communities. So it does open up a wide area, which of course are important, but it's something to definitely think about in the future.
But I will pose it this: since financial was the challenge, then I says, okay, well, if money was the real issue, then maybe we can use modern technology. Like, for example, we could, in honor of sickle cell, we can actually create NFTs that are about $25. And since this researcher was only looking for 300 people, let's find either these 300 people or 300 people and get them and, open it up to anybody that wants to support the test. And it would be the cost of an NFT that is like $20. There are ways that you can mint NFTs for free, and you can make something like that happen. And then let's see what happens. And if there's something that's merit here, then we put the policy and the system and everything together.
Yeah, because in there again, you'll see our keyword collaboration. So you can be looking at, there will be a number of entities where collaboration within this area fits their interest.
Yes.
Which is the most important thing. And then you can make progress from there to improve the outcomes for patients, but also building the capacity within the system itself. And technology has no gatekeepers. So it's just about thinking, whole system thinking. So I think it's excellent. And I look forward to the progress you are undoubtedly going to make.
Yeah, and thank you. And I also want to give thanks to my former student, who is now Dr. Kimberly Scott, who assisted with the research. And one final thing with regards to Kishma, who was behind me when she was hospitalized. She didn't just sit in the bed. She went to all of the children's rooms and worked even in communication to try to ensure that they were heard. She was a strong advocate for sickle cell anemia, and we should continue her work in whatever way we can.
And that's excellent. And as we say, all voices must be heard.
Yeah.
Thank you very much. And
thank you.
See you again soon.
All right. Thank you.
Bye.